Understanding and knowing how to interpret acid-base balance is very important in nursing school. So let's do a quick overview on this and listen as I give you some tips and tricks on how to easily get this done. If the acid levels in your blood is too high, it's acidosis. If it's too low, then it's called alkalosis. There are 4 acid-base disorders that you must know. They are metabolic acidosis, respiratory acidosis, metabolic alkalosis, and respiratory alkalosis. One of the biggest challenges students face in nursing school is deciding whether or not they're dealing with a respiratory case or a metabolic case. And one of the simplest way to decide that is knowing that if it's metabolic, then the pH and the bicarb will go in the same direction. So if the pH is high, the bicarb will be high. And if the pH is low, the bicarb will be low. That will help you decide if it's metabolic. If it's respiratory, then the pH and the CO2 will go in the opposite direction. Now that you know how to figure out if you're dealing with a metabolic or a respiratory case, you need to figure out whether or not it's alkalosis or acidosis. This is the simplest part of it. If the pH is less than 7.35, it's acidosis. If it's greater than 7.45, it's alkalosis. Most nursing school won't stop here though. You will need to understand how to figure the level of compensation. To understand this, you must know if the imbalance is respiratory, be it acidosis or alkalosis, for it to be compensated, the bicarb value must be abnormal. Remember, as was taught in A&P class, the renal system compensates for the respiratory imbalance. So whenever time we are looking on whether or not we are getting compensation in an imbalance case, in a respiratory imbalance case, we need to be focused on bicarb values, whether or not it's abnormal. If the imbalance is metabolic, for it to be considered compensated, we need to look for abnormal CO2 values. If the values are indeed abnormal in either cases, you must look at pH. If the pH is normal, it's fully compensated. If the pH is abnormal, it's a partial compensated case. Anyway, I'm going to cut this video short as I don't want it to be too long, but I'm going to do a part 2 so that we can go over examples. Once we go over the examples, you should have a clear understanding on how to interpret ABG values. So see you later.